Welcome to Long COVID Doctor, an educational series for sufferers of long COVID. I'm Dr. Tim Robinson, formerly a family doctor, GP for 30 years, now GP lead for 3 NHS Long COVID clinics, and a GP clinical lead in long COVID across the southwest of England. This episode is on skin problems and long COVID. In part 1, I talk about the symptoms, the diagnoses and their causes. And in part 2, I'll talk about the general management of long COVID and how that helps with the skin problems of long COVID. Check out the references and resources and links to social media in the show notes below. Just to say, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own doctor or medically qualified health professional. And so here we go, skin problems and long COVID. Skin problems in our patients with long COVID are quite common. The conditions and their symptoms are not usually considered as serious by our patients as all the other more troublesome symptoms of long COVID, such as the fatigue, the brain fog, pain, headache, breathlessness, are considered sort of more troublesome. And so skin problems are not usually brought to our attention. However, they are frequently there and discovered in the patient assessment in our clinics, and therefore certainly worth consideration. There are a number of symptoms and skin changes, signs that patients report to us. These can include itchiness, irritation, blotchiness, small blisters, like chickenpox, changes in colour, going red, white, purple. There may be worsening of previous skin conditions, such as eczema, or seborrheic dermatitis or rosacea. There may be reactivation of cold sores or even shingles coming for the first time. That is reactivation of the chickenpox virus, herpes zoster virus. Associated with skin problems, there can be hair loss, experienced by many patients after the initial COVID infection, but taking a long time to resolve. There's a separate talk on this, which you may like to see or listen to. And finally, there are pins and needles in patches, usually on the limbs. This isn't strictly a skin problem. It's more to do with the nerves underlying underneath the skin. And so more part of the lasting effect of the virus on those nerves, not so much to the skin itself. Nevertheless, I mentioned it here just for completeness sake. It's just another thing that can happen with long COVID skin. Again, I've posted all about pins and needles previously. You may like to check that out. So, those are the things that our patients are telling us with regard to the skin in their long COVID, bringing those things to us in our long COVID clinics. So, what are we going to do for those patients? Unfortunately, all the conditions I've mentioned have different causes, different processes, and so they all have different ways to tackle them. And so I will go through each of them one by one, explaining the mechanisms so that you can understand them, understand what's going on, and therefore any potential treatments that may relieve those skin problems. So, firstly, and probably the most common long COVID skin problem, and that is hives or urticaria, a sort of itchy rash, looking like and feeling like a stinging gnattal rash anywhere over the body, usually coming and going, usually raised, pink patches. This occurs typically in mast cell activation. As we know, this is part of the overactive inflammatory response, causing the mast cells to release histamine and lots of other pro-inflammatory mediators, causing lots of symptoms in the gut, such as indigestion or loose motions, food intolerances, problems in the upper and lower respiratory tract, such as runny nose, rhinitis, nasal congestion, sinus congestion, but also a wheezy tendency and also cough. And then finally, mast cell activation produces its problems in the skin. If you want to know more about mast cell activation, see my post for that for a fuller explanation. If you've got mast cell activation symptoms, and in this situation, in this talk, to do with the skin, those hives, that urticaria, we're lucky. We're in luck that this is a condition that we can do something about. Treatment with antihistamines and antacid tablets in combination, so-called H1 and H2 blockers. H stands for histamine, so histamine blockers. We usually suggest starting at the once daily dose and doubling that dose if there isn't any improvement after a few weeks. You may have read about or heard about patients who have been given even higher doses of those H1 and H2 blockers for this condition of mast cell activation. However, I would discourage this without seeking advice and supervision from your own GP, your own family doctor. So that's skin conditions due to mast cell activation. The second group of skin conditions that can be presenting in our long COVID patients is a sort of blotchy rash, pink or red, usually generalized, a maculopapular rash, it's so called, looking like measles rash. Not that we see that very often these days, thankfully, because of MMR jab. However, this sort of general rash is a result of excessive inflammatory response that has persisted. Unfortunately, it is difficult to deal with because there's no specific treatment that dampens this down. Awaiting the normal recovery from this takes time, and it comes down to doing all those things, general approaches and strategies that we recommend for overall health restoration. In Long COVID, I cover this more fully in the second part of this talk. Related to this excessive inflammatory response is the next group of skin conditions that we are seeing in our long COVID patients, namely worsening of or flare-ups of previous skin conditions such as eczema or seborrheic dermatitis or rosacea. So a few words on each in turn. So eczema, so inflammation of the skin, is treated with rehydrating emollients, emollient creams, so sort of moisturizing creams basically. So there's Pseudo-Creme or E45 or Double Base, aqueous cream. These can all be bought over the counter in your local chemist, along with the other treatment, obviously, which we've all heard of for eczema, steroid creams, as prescribed by your GP, your family doctor. You'll be advised by the GP, how to apply them, how often to apply them, and to apply them sparingly. It's usually sort of 2-3 times a day only, because of the worry of skin thinning with excess steroid application that can result from excessive application. The second condition, seborrheic dermatitis, more commonly known as dandruff, dry flakiness of the scalp, is best treated with betnovate lotion or ketoconazole Nizoral scalp application. So you can buy the Nizoral, ketoconazole, over the counter at the chemist, but obviously you'll need a prescription for betnovate, as it's a steroid lotion. And then thirdly, it's rosacea. That's a sort of a reddish rash over the cheeks in a typical butterfly pattern that can be flared up in long COVID. This is treated by the GP with low-dose antibiotic tetracycline tablets or a topical antibiotic cream called metronidazole. Like I said, this is on prescription from your general practitioner. So those are the conditions that can get flared up in long COVID, the pre-existing conditions. So now on to the next group of skin conditions. And I've grouped these together because they are probably due to the same underlying dysautonomic processes that are possibly happening throughout the body. Again, check out my podcast or YouTube video on this fascinating and annoying condition. Basically, just to remind you about dysautonomia, which stands for dysfunction of the autonomic nervous system, which is throughout our whole body, controlling all those processes automatically, such as pulse rate, blood pressure, breathing, temperature control, balance. Unfortunately, dysautonomia also causes problems in the skin, probably due to poor control of the blood vessels, particularly in the peripheries, the lower arms and legs, especially hands and feet. Probably due to incorrect signaling from the brainstem, and probably mostly the temperature regulation center in the brainstem, but also direct damage to the peripheral nerves that control those blood vessels in the peripheries. And probably also another factor, causal factor, is probably microclots, microthrombi in those blood vessels also. And so we all remember, now we're focusing on dysautonomia effects, we all probably remember COVID toe in the acute COVID illness. All those mechanisms result in this, all those dysautonomic mechanisms result in that COVID toe, otherwise known as pernio, but also more simply known as chilblains. That is sort of reddish purple bumps that are sore and very itchy. Also difficult to treat. Usually it's just a matter of keeping the area clean, bathing it with salt water, saline, and application of dry dressings. Obviously, if there is any sign of infection, such as worsening of pain or inflammation, or there's discharge, if it becomes mucky, etc., you ought to be consulting your doctor about your COVID toe. Another condition that we see also in this dysautonomia category is a condition called acrocyanosis. In this, there's an obvious colour change in both feet, and sometimes creeping up the sort of the shins towards the knees. And they go sort of a reddish purple mottled look, often with some swelling, sometimes even sweating of the skin over those areas where the discoloration is occurring. And these changes occur with prolonged standing that then settle as you rest with your feet up. Along with those dysautonomic skin changes, there may be associated palpitations or lightheadedness, faint feelings, again pointing to dysautonomia, and maybe even POTS, postural orthostatic tachycardia syndrome, rapid heart rate, heart beating with prolonged standing, maybe with a drop of blood pressure. So these feet changes, especially if it is with that purple appearance with standing that we call acrocyanosis, as I've said, should always alert you to the possibility of dysautonomia, which needs to be assessed and investigated in its own right, as there are medications that would help this and hence help with those foot problems also. So see my posting on dysautonomia and POTS if you want to know more about these conditions. So, and then finally, as I mentioned at the start, we have seen a number of patients with herpes simplex eruptions, that is both cold sores and genital herpes, and also shingles, the herpes varicella zoster virus. These viruses are normally kept dormant in the tissues, but when when the immune system is impaired or stressed, these viruses can be reactivated. As we know, in long COVID, the immune system is affected and it's impaired. And so it's not surprising that we are seeing these conditions in our long COVID patients. Treatment of these conditions is really in the hands of the GP. The antiviral treatment acyclovir and the newer versions of it, if prescribed within 3 days of the onset of the blistering rash, could be considered. And so that covers the long COVID skin conditions and their causes and treatments. And that concludes the first part of my talk on these conditions and how they are best managed. In the second part, I'll talk about the general management of long COVID that will assist in the recovery of the condition overall, and more specifically, those skin conditions that we are seeing in our long COVID patients. So, I hope you found that helpful. Check out the references and resources and links in social media in the show notes below. And as I said at the start, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own doctor or medically qualified professional. So in the meantime, I wish you well. I wish you well with your long COVID recovery. And hopefully we'll meet in the second part. Cheerio.